a very warm welcome, everyone, and thank you for joining us today on this very crucial discussion. And before we start this session, there are a few safeguarding instructions that we would like to share with everyone. We would request everyone to kindly identify or introduce yourself with your name and city in the chat box. And if you're joining again, if you have joined the part one of the webinar, we would request to share one big takeaway that you have learned in the first webinar. That would be a great help for us. And would request everyone to please keep their mic off and their videos on. And if you have to share or speak, please use raise hand icon so that and wait for the facilitator to call your name so that you can share your concerns or questions or what feedbacks. And if you have to share any views, comments, innovation, and best practices when the sessions is ongoing, I would request everyone to please use the chat box. And as you all know, we are very committed towards safeguarding the children, and in adherence to our child safeguarding policy and practices, none of the speakers will be using the real names or locations while giving examples. And I would request all the participants, all the audience to also maintain the confidentiality of children while sharing examples during question answers or when you're sharing anything. We will be this agenda. The agenda for the webinar, we will be discussing setting the context in the beginning, and then we'll be moving forward to talk more about the history of the global transition framework tools and building global capacities. After the session, we will be discussing what the tools is all about, how these tools can be contextualized in Indian setting, and we'll be seeking feedback from the participants for the contextualization of the tools. Before we proceed for our session, a very quick recap of what we have learned in the first session. The first session was all about understanding or building a common language for transition.
Kavita, sorry to interrupt you. Can we move? There we go. Now the slides are moving. Okay.
Okay. Is it visible now to everyone?
Yes.
Okay, thank you. Yeah, so I was just saying before we go forward to our today's webinar, just a quick recap of what we have done in the previous webinar. And the attempt was made to, make a common understanding and the language on transition. And transition, as you can see, is a process of changing the models of care and services provided by an organization or government authorities from residential model of care to the family-based care services. And it's family-based services. This transition involves at all levels. The transition involves at all levels and include safeguarding of children and also keeping in mind the best interests of the children. As you would see, transition is an integral component of the child protection and care system from reforms. You can also see there is National Child Protection System and policies in India, Mission Vatsalya, or JJ Act have also talked about family-based alternative care and have recognized the right of the child to family care as the optimal environment for growth and development versus the detrimental effects of institutionalization. In this phase, in the previous webinar, we've also learned about the transition cannot happen in just as an activity. It's actually as a process which needs to be done in a phases wise. As you can see on your screen, during the phase one, we talk about building the awareness and the reasons why transition is important, building why creating evidences or understanding the evidences why transition is important. Also exploring the local context for transition, mapping human resources, identifying technical support and linkages, and engaging with others. So this is important for the first phase, that before we move to the transition actual, there should be a awareness building and generating evidences for transition. In phase two, we have talked about preparation of transition, how transition for preparation you would require support from key stakeholders such as authorities and the institution's director to plan for planned transformation and proposed model of execution. The phase two talks more about preparation and building and onboarding processes, where you also utilize existing community services, mapping and data to identify support services for reintegration of family placement, and also align the transformation plan with national government guidelines and mandates. And you would see in the during the phase 2, it's also important to develop a plan for transition, conduct holistic child and family assessments linked to the national child protection system and social services, and prepare for a case management. This phase requires extensive planning for transition, how it will be done, and a capacity building of the stakeholders and decision makers. In the phase 3 of the transition, we actually talk about the transition in action, how the transition will look like, what it requires at institutional level, at social workers level. And you would see at institutional level, changes must be made in human resources, funding, infrastructure, and programming. And this requires good planning and comprehensive guidance so that every aspect of the transition can be successful and goes at pace, right for each institution. And at the it is also very important at this stage that the time at this time, planning and thought to be dedicated to to preparing the child and the family for placement, connecting to the social services, and ongoing monitoring. At the social level, it is important to have an comprehensive case management for reintegration, family tracing and assessment, case planning, approval and placement, and monitoring, which are the important parts of the transition phases. And if you want to learn more about the transition, basics of the transition, I would request everyone to visit ISCN's YouTube, and the link can be shared with you here in the chat box. And you can see the recording of the part 1 of the webinar there. Moving forward, we will be discussing the objectives of the session today. So today we will not be going to the basics of the transition, as I already shared. We will be focusing more on introducing the global transition framework tools, as you can see on your screens. We will be talking more about the global transition framework tools, its roots and its elements, and how these tools can be utilized as part of the transition in regional and local contexts. We would be focusing more on how part of the transition today, and also we would be listening to the experiences of the practitioners from other countries who have contextualized these transition tools, and also or in the process of contextualizing the tools. Later in this session, we would be seeking suggestions and feedback on contextualization of these tools, and also how it can be rolled out in India. So these are the broad objectives of the webinar today. Okay, so before we move to the technical aspect, I would request, we have planned two very simple questions for all the participants, and I would request everyone. So please have a look at the instructions for Mentimeter. When you will receive a pop-up on your screen right now, you just have to open on the tab. You have to click on the open tab, and you can see the presenter's screen there with the questions. Keep the Mentimeter available. Wait, Anisha, can you just wait for a minute? Yeah. Okay, so you can see the presenter screen now. Yeah. And those who are not able to receive this pop-up, I would request you to please go to your browser, or a link has been shared in the chat box. You can just directly click on the link, and you can see the questions. You can see the questions to answer there. Let me know, please see you can click on the link which is just shared by Anisha. Yeah,
It's
with
not in
this
the
link,
chat yet. There we go.
yeah, it's a link. You can just click on the link, or if you're unable to open this link, you can go to your Google browser and type join Mentimeter. And once you click on the link which is given by the Google, you can just add the code here. I'm sharing the code with everyone. Yeah, just 1 minute. This is the code in case if it is link is not working. All right, these are the code and the link. Okay, Anisha, can we go to the first question now?
Let me know if you can see my screen. I'm
Uh,
unable to do it at the moment. Just give me a second, please.
yeah. Yes, Anisha, we are able to see. I hope everyone is able to, those who are joining from the computer, they will receive a pop-up link, and you just have to open that pop-up link. If you are unable to receive the pop-up link, please cl click on the link given in the chat box and you will see the dialog box there. Okay, please join the link. Please add the code or and join the link. Okay, Anisha, can you start the first question here? Hi, Anisha, can you hear me?
Yes, Kavita, I can see it on my screen.
But I think we are not able to get the questions here.
Okay, just give me a second.
Yeah, can anyone tell me if they are able to see the question?
No.
Okay,
Now we
now
are.
we can see the questions. Yes. I mean, I request everyone to please have a look at your screens now. And those who are able to participate, those who have received the pop-up, just open the link and join. And those who have not able to receive the pop-up, I would request everyone to please click on the link shared in the chat box and type the code. You will be able to see it. Umesh, can you, yeah, okay. If you're not able to see the question on screen, I would request you to please click on the link and type the code.
I can go back to the previous slide, which has the QR code so that people can scan it again and go directly. Will that work, Kavita?
8 minutes, because I
I can
can
see
see
a
the
lot of responses
responses.
coming in.
Yeah.
If anyone is still not able to see it, you can directly log into Menti, and with the code, you'll be able to easily log in.
Yes. You can just click on the link here. Okay, I can see a lot of responses now. The question was, what are you most eager to learn about transition today? We have received a lot of responses, and it says ki transition take place, how a transition take place, that we will be very discussing soon. How CCIs can be transition tools, to learn more about transition tool, to understand the process of transition, different best practices and effective tools in use globally and different regions in India. So these are the responses that we have been receiving. So far, we have received 35 responses, and this is very wonderful that people are very eager to learn about these tool. And this is the webinar is also all the webinar is about this only, how we can use this transition tool and contextualize in the Indian context and practice this tool, take use of this tool, utilize this tool to transition from the institutional care model to a family based alternative care model. So we've been receiving a lot of responses. This is very encouraging. Thank you everyone for participating. And those who are not able to participate, I would request people to put their responses in the chat box. Wonderful. What are the tools to measure the transition in family-based care? The experiences from across the globe on use of the tools, both a practical and experiential perspective. Okay, wonderful. How can we collaborate globally to enhance the transition tools and framework? So these are the responses that we have received. We have received 46 responses so far. And this is very interesting. But we have 88 people, and I would request people to quickly respond. And you can also use the chat box to share your responses. Okay, thank you everyone. Thank you. And we've received a lot of responses here, and it is very encouraging. And we will be talking about how this transition tools, what the tools are about, and how this transition tool works. Anisha, can you go to the next slide, please? Okay, so this is the next question for everyone. Why might it be important to support CCIs in transition? So we request everyone to please participate in this question also. Okay. If you're the same link can be used, and you can share the code here. Code is shared here. You can use this code to give your answer. Please use the link given in the chat box to. Yes, so I have started receiving the responses again. So why it is important to support CCI in transition to ensure their accountability and ownership, to avoid abrupt unplanned restoration, which is a very important aspect. We have to make sure the transition should not re-traumatize the child and also the family, and make sure that the reintegration is safe. To ensure children's rights and interests are safeguarded, to provide technical support where needed, to encourage CCIs as transition is challenging. Okay, wonderful. To ensure quality of transition, because most of them don't have the resources and enough knowledge. So that's why it is also important. So with this, we can also understand that it is also important that there should be a capacity building and of the stakeholders who are working in the CCIs to support them in transition process. Okay, thank you everyone for sharing. Please quickly give your responses. And if you are still not able to see Menti in any ways, I would request to please use chat box to register to share your responses. So we have received 34 responses right now, and these are very encouraging. Share insights, case studies, and other forms of collaboration. Every child needs to live safe and nurturing environment. Reintegration is important so that children can receive best care possible. So yes, it is important that we support CCI so that children receive best possible care and have their right to live with a family, nurturing and loving family. Okay. Any more responses? Please give your responses. We have only received 42 responses, and we are 80 people, more than 80 people have joined. All right. Any more responses? I would encourage to share more responses here. Okay, Anisha. Okay. All right. So I think we can move to our next session now. Anisha, please stop the Mentimeter. Yeah. Anisha, can you hear me?
Yes, just give me a second, please.
Yeah. Okay. Thank you, Anisha. Thank you, everyone, for participating in these quick questions. And I agree, it's really important to support CCI to ensure that the children do not suffer or the children do not go to trauma, and their rights are ensured of a family. And also there should be safe reintegration to the CCI from a residential care model to a family-based care model. Thank you, everyone, for participating in the Mentimeter uh, chat. Okay, so moving on to do our first session with us on understanding the background history of the transition framework tools and building global capacity. We have with us Miss Beth Bradford from Senior Associate Mistral International. I would invite Beth here. Welcome, Beth, and thank you for joining us today.
Thank
Okay,
you,
Beth.
Kavita, for the invitation to be here.
Yes.
I'm very happy. Could we have the slide deck, please?
Yes, we're going through. Okay, I'll just, Anisha, can you make Anna's host again? Yeah. Yeah.
While we're getting the
So,
slide deck.
yes, I'll
Yes,
just
please go ahead,
introduce you.
Kavita.
So Beth
Okay.
Bradford is a senior associate with Maestro International and former technical director of Changing the Way We Care. She has 30 years of experience in international child protection, including work with both government and non-government partners. Beth has focused her career on child protection and care system strengthening, integrated case management, social work practice, transition of care services, alternative care, and family strengthening. We really welcome you, Beth, and for coming to be part of this webinar. Thank you again. With Beth, we have today Miss Rebecca Neff. Miss Rebecca Neff is the Senior Technical Advisor for Better Care Network. She has 22 years 22 years experience of working in the international development and child protection sector, focusing on focusing on the focusing on care reforms, transitioning residential care services, and combating orphanage trafficking and orphanage tourism. Rebecca is the co-founder of Rethinking Orphanages Network Australia and co-chair of Rethink Orphanages Global. Rebecca is also a member of the Australian Institute of Criminology Expert Advisory Group for the monitoring of the Australian Government National Action Plan to combat modern slavery, and Australian Institute of Criminology, Human Trafficking, and Modern Slavery Research Network. Rebecca is the co-chair of several expert working groups under the Transforming Children's Care Global Platform, including the Transitioning Residential Care Working Group and Orphanages Tourism, Volunteerism and Trafficking Task Force. Rebecca holds postgraduate degrees in International Development and Anthropology and is a PhD in Law candidate with Griffith University, Australia. Thank you, Rebecca, for being part of this webinar, and very warm welcome to you.
Thank you
And
so
I
much.
would request Beth to please take over from here.
Thank you, Kavita. What a wonderful introduction that is. And I will just echo the same message that it's really, really great to be here and really great to have you with us today. Rebecca, thank you for joining. I know personally that you have been involved in transition of residential care facilities for a long time and have a lot of insights and experience to share with us. So we really appreciate that. Let's begin. What we're going to do now is just have a bit of a conversation so that you all can hear a little bit about what's happening globally around transition, and particularly around supporting transition and the different tools to do that. So maybe if we can start with a question, Beck, can you just share a little bit about the background and history of the global transition framework and the tools that go with it?
Absolutely. Thank you, Beth. And it's really great to be here and see lots of familiar faces and names and also new ones as well. So thank you for having me. So yes, definitely. In terms of the background, the Global Transition Framework tools are all interagency tools, and they've all been developed by or with input from members of the Global Transitioning Residential Care Working Group, of which there's a number of people who are part of this webinar today who are members of that group, including some of your steering group members, Mana Rajan, for example. And importantly, these tools have been developed by practitioners from various countries around the world and various contexts, and they've been developed for practitioners to promote and strengthen evidence-based practice for transition of residential care services. So this working group was launched back in 2020, and at the time there really was no consensus understanding of what transition of residential care services was, what that term meant, what was included, where it started, where it ended. And there was a lot of different people using that term to refer to different things, often just one part of what we now know to be part of transition, for example, reintegration. And so this was causing a lot of confusion, and it was also preventing us from really being able to collaborate well. So we saw the need to develop the phases transition diagram. And that was a way to generate consensus on what transition was, what it includes, and to give all stakeholders who might be involved visibility of what transition entails, whether that's a director or a donor or a partner or a government or a technical organization. And so that particular diagram actually demystifies what transition is, and it gives us all the very common language and framework to talk about transition, and that helps us to collaborate better. It also enables us to capture learning, to document, to gather evidence, and to strengthen our evidence-based practices. The Transitioning Models of Care Assessment tool was actually the first tool developed of the three, and that started around 10 years ago, actually, when a number of us were working on lots of transitions across different contexts, and we started noticing all of these trends, and they were around factors that your standard residential care assessment tools don't capture. And so we kept seeing these patterns, and as we were coaching other practitioners, they were seeing these patterns too. And so we found we were answering a lot of the same questions and responding to these situations in different contexts. And so we thought there was a need to put that information and those trends together in a tool that could again make them visible to other practitioners and help them to use that to benefit their practice and to remove what was turning out to be some kind of invisible obstacles to transition that was really preventing people from being able to progress or progress effectively. So that tool was also inputted by members of the Residential Care Transition Working Group, and it became an interagency tool that was tested and piloted in different countries before it was released. And then the third tool is the cost estimation tool. And again, the background to that was it was designed to remove another barrier, which is the inability to understand how much transition costs. Does it go down straight away? Does it go up before it goes down? And some organizations were finding they couldn't get their boards to agree to transition without knowing the cost. Others were finding without understanding that they would get halfway through a transition and actually didn't have the funds to be able to address some of the issues that came up, and that was impacting their practice. And so that tool was developed in response to that felt need, and it was really to enable everybody to gain visibility of what transition can cost. And it was developed using data sets that were analyzed of people who'd already gone through transition, so we could understand how the costs were impacted and by what factors. So again, another interagency tool developed by practitioners from lots of different countries in order to benefit other practitioners and give them a way to learn from the experiences of the past and use that to improve their practice. So, and the reason why that kind of history is important is because none of these tools are prescriptive. They all recognize that our contexts are actually really different. And all of the practitioners who were part of that process came from different contexts. So it really takes the learning and the trend that goes across different contexts and helps us use it to make sense of our own context and then draw on that learning and evidence in order to develop your own strategies that are context relevant and specific, knowing that transition looks different in different countries, but also from one institution to another. So that's in summary how we came to have these transition framework tools and how they're connected to the global work around transition. Thanks, Beth.
Sorry about that.
Oh, you're on mute again.
Can you hear me now? Great, thank you. Thanks so much, Beck. I think it's really interesting. A lot of what you described are the things that people were saying in the Mentimeter about why it's important to support transition. So really, really helpful to hear what the experience has been globally over the last years. Thank you for that. So I guess I wonder, why do you think this transition support and using tools, particularly these tools that have been developed and are based in evidence, why is that important to transitioning residential facilities? Is there evidence around why support works, why it's important?
Yeah, absolutely. The global learning overarchingly shows us that transition is really complex. For some aspects of, child protection or care reform practice, it might be repeated patterns that we see, and therefore those kinds of processes lend themselves to very simple kind of 10-step types of programs or processes that can be repeated in different contexts. But transition's not like that. Transition is really complex, it's diverse, and it's so heavily influenced by the dynamics that you find in your starting point for any given residential care service that goes through that transition process. And so, this is even more compounded, or it's even more the case when you have residential care services that are privately run, when they're privately funded, and when you have to actually engage with and manage a lot of different stakeholders and their motivations and their fears and feelings about change processes all at the same time. And we also know that those stakeholders aren't all in the same country. Many times you have partners that are overseas, and so you've got different cultural dynamics coming in as well. And so there was those experiences and that learning that really showed us why we need tools that are evidence-based but not prescriptive and really are sense-making tools. And we found that practitioners providing technical support for transition, you actually need to develop forensic skills, like you're an investigator almost, to be able to probe, really understand what's happening below the surface in every residential care service that is considering transition or that you're working with. And you need to be able to respond to what you find, respond to the things that you draw out of that particular context. We also need to be able to collaborate across countries to bring the donors, the overseas partners on that journey of transition in tandem so that they are working together and they're working together effectively. That's really important to making transition safe. And so this level of international collaboration is especially required when we have so much of the funding for residential care coming outside of the countries where the services actually are. So again, that was some of the learning that really showed us why these tools are required, because it does enable you to facilitate that type of complex collaboration. I think the other important thing to note is that transition takes a lot of time. It's actually really intensive. There are thousands of residential care services out there. They need support to go through this process. So we need to increase our capacity at the national level. And we need to increase the number of practitioners that can do this work and do it well and upskill them. And part of upskilling them is giving them access to evidence-based tools and resources that mean they don't have to learn all those lessons from scratch, as some of us did. They can effectively move forward quicker, develop their capacity quicker, and be able to effectively support those services. So I'd say they're the main reasons we see from the evidence as to why these kinds of things are necessary.
Thank you so much. I think that's really, really helpful, and again, very reflective of what colleagues were saying for the Mentimeter. And I think you're already alluding to my next question, which is, you know, are there tested approaches, strategies to promote and use these tools in a context like India? So it's wonderful that these have been developed. It's great that they're working in some places, that there's a group at a sort of global level that is using them. I know myself, I've used them, but I'm not in a country where I'm doing direct transition support. So just curious to hear very briefly, we have a few minutes left, you know, what you're finding in terms of, again, the testing of these kinds of approaches in other countries.
Sure. So really, we started this probably about 18 months ago. So we've taken the tools, we realized that just putting them out there and not providing training isn't enough. These can be, some of the tools are more complex than others. So the working group actually developed a train the trainer program that is about introducing the tools, building practitioners' capacities to use these tools. And it's a training program that goes for 3 to 4 days. And it was rolled out at the global level last year to train the first cohort of trainers, of which Manarajam is one. So he's the resident expert of this group for India to deliver the training in country. And then that training's been replicated regionally in Latin America, across a number of countries in Africa, and now inside of certain countries. So this is a framework that enables the tools to be delivered and the training to be delivered in country, so that we're not just handing people tools and saying, you work it out, but it's actually wrapped up in a training program that can help it become part of national strategy, including for capacity building.
Excellent. Excellent. It's really, really exciting. I know, having been in the field for many years, seeing it really all come together like this is really important and really helpful and really exciting. So maybe just finally, can you speak a little bit to, I've been part of the working group. We want to welcome other people. We'll put a link in the chat to that working group. But I know there's a capacity building roadmap that has been developed. And I'm curious, why did the group feel like this was important to develop? What is its purpose? And what kinds of things are included there? Maybe also, just while I give you the mic, we have about 5 minutes left in our conversation, what's been accomplished so far. You mentioned it a little bit, but yeah, curious to hear more about this.
Yeah, as with many things, it's almost like you walk yourself backwards, isn't it? Like you say, oh, we need these tools, but oops, we also need training for the tools. And then we got the training ready and we went, oh, actually, we need to make sure this is connected to national strategies around care reform, of which the transition of residential care services is one part. So really, this capacity building roadmap was developed to address that. It was to situate this within countries' care reform strategies. And it was actually to look at how do countries develop the capacity and the processes to be able to do this at scale, not just one residential care service here, one there, but how do you prepare to do this at scale so you really can see that shift in your service system? So this was developed for governments. It was developed for non-government partners working alongside governments to help them identify the priority areas for capacity building that would allow them to both ensure that their systems were ready for transition and that they were building the human resource capacity to be able to provide technical support to residential care services undergoing it. And so the roadmap includes an aspect that looks at the macro level enabling environment. It really identifies specific parts of your system reform, your laws, your policies, your mechanisms that will enable you to move forward with the transition of service component of your care reform. So it's not saying they're all the things you need to do, they're just the things that really enable the transition aspect. Then it looks at building organizational capacity. And it does that by looking at how do you reduce inefficiencies? Because if you don't have the right support, transition can take a lot of time, a lot of organizational resources, and not get very far, to be honest. So this is about how do you reduce inefficiencies? How do you increase organizational capacity so that they can support more transitions? And then thirdly, it looks at developing the strategy for building competencies of practitioners or interdisciplinary teams who can provide that technical support to see that transition can be scaled, but also done in a way that is safe and effective for children and their families. So it includes those three different sections, and you can see there the core competencies on the screen, of which there are 10 categories. And in the map, it breaks that down even further and shows what those competencies link to, what the skill sets are. And then it includes some priority training modules that you can build into your national strategy, into your social service workforce training, for example, to make sure that it's taking the transition component of care reform into account as it progresses. It also, if we can go back one slide quickly, includes this categorization tool. And this is about a smart way of identifying which residential care services are ready for transition. And it uses two filters. Legal conformity, so it's saying which ones actually under law need to transition or potentially be closed because they're not registered properly, or there's issues with minimum standards violations or child protection violations. Which ones are compliant with law, and therefore it's actually voluntary whether or not they transition. So it helps you filter that to identify which residential care services you may want to target. Then it leads you to assess for readiness so that you can actually target the ones that are ready, the ones that want to transition, the ones that are in a good position to transition. And then you can prioritize the allocation of your resources towards those residential care services to maximize the efficiency of transition. So it's kind of a prioritization tool that's also included in the roadmap. So again, it's really about giving you strategies to build this into your national action plans. How do you build the workforce for readiness? How do you develop prioritization systems? Some countries have a target in their national plans of reducing the number of services by 30% or the number of children in services. And that requires us to have approaches, ways to go, well, which ones? How do we work out which ones we should go for and which ones we shouldn't? So it helps with those kinds of things, as well as, again, building your workforce so that they have the specific skills required to do that complex work of transition.
Excellent. That's super, super helpful. And we put the link to the both the landing page on BCN, the Better Care Network, but also the link to the capacity roadmap so that people can have a look in more detail at those. those different competencies, but that's really helpful overview. You know what, let's go next to back to our participants and see what their thoughts are at this point. So we're going to cue another Menti question, and this one is going to be about what tools do you think might be most helpful to you in your own transition work? So give a thought for just a moment about that question. What tools are most helpful to you in your transition work? And let's hear from our, I'll call you the audience. You should see again a pop-up, and or you can go to the link that you see in the chat. So we'll just give a couple minutes to see what people are now thinking. Get your thinking going. You can also put your response in the chat. What tools would be most helpful to you in your work? And it looks like I'll need somebody else to read out. It's too small for me to be able to see. Thank you,
Should
Lena.
Yeah. So the responses are cost estimation tools, then tools for advocacy.
Oh,
then
yes.
there is another
Yes.
response, capacity building tools. These are important tools that people are saying it's important. Then having an individual family assessment tool is another important aspect that they are looking into. And then we have a follow-up and monitoring mechanism, the tools related to follow-up and monitoring. And then donor buy-ins and transitioning model of care assessment tools. So this is very interesting.
Yeah, and a wide range. I think this is a great point about
yeah. So
about
there is also
a wide range.
Yes. Training of different levels of functionaries, building acceptability or for transition importance. So I think they're also talking about the awareness and advocacy tools, which are important, which we've discussed in the transition part 1 of the transition, and capacity building roadmap. And there's one life skill assessment also. Tools
Interesting
for
yes. Yeah. So tools for the work with children and youth, especially maybe young people who will be exiting care leaving.
Then there is case management tools, planning, action, follow-up, and monitoring tools. So these are important things. So the important aspects for the transition, I believe.
Absolutely, that's excellent, and I'm really glad that those tools around moving children are really important. So thank you so much, everyone. Feel free to continue using the chat to put your comments. Let me just thank you so much, Beck, for joining us. I know we're going to hear from you again in a little while, but it's really helpful to frame all of our thinking around these global examples and sort of why this is coming up, why we're hearing more and more about the importance of global tools. We can go ahead and go back to the slide deck. Yeah,
sure.
And we're going to, I'm sure we've now piqued everyone's curiosity. We're on slide 20. We've piqued everyone's curiosity about the transition framework tools. And we're going to dive into that
slide
now.
20.
Yeah, thank you. There we go. Yes. And I'm going to welcome Manoranjan to support me here for a very fairly brief discussion about the transition framework tools. We really hope that you've had a chance to read the pre-reading that was shared in advance of this webinar. We are not going to spend a lot of time on each tool. We're going to give a high-level overview. But you received links in that pre-reading to videos that explain what each tool does, what its purpose is, how to use it, when to use it. So please, if you haven't already had a chance, do that pre-reading at some point, or explore the BCN website, where you'll find the tools and lots of information about how to use them. So Manoranjan, as we move through, welcome you to chime in. You were part of the very first training on this set of 3 tools, and I know that you can speak to them probably better than I can.
Yeah, thank you, Beth. Warm welcome to everyone else. Yeah, so I was part of the TOT in Cambodia, like Beck actually mentioned earlier. And probably Beth is going to actually present the 3 tools to evolve. But from my experience from the TOT and post to the implementation of those tools in Tamil Nadu as a part of the transition pilot of changing the care initiative. So I found the care assessment tool is really fantastic because one of the core competency is for the transition stakeholder engagement. And the better you know your stakeholders, the better you explore your context, the more effectively you can plan and implement your transition. So in that sense, this is a fantastic tool. It is used primarily by the practitioners who assist the transition process and provide technical support. So we'll explore that tool in depth. The link of the tool is also going to be provided in the chat box. So later on, you can go through that. But briefly, I can also say the second tool, which is very, very effective, the phases of a transition, which really gives you the steps, gives you the guidance to navigate very easily through the transition process to nurture another core competency, which is risk management. Because one of the core non-negotiable factor of the transition is do not harm to anybody else who are a part of the transition process. So that is another interesting tool I found in India context and across in every region and other context as well. So that is a fantastic tool. We can actually get through that.
Great.
Yeah, about
Great.
you, Beth.
Great, thank you. So as Manoranjan has already described, there are 3 tools within this set of tools. The first one is called the Phases of Transition Interactive tool. This is, yep, thank you. That's the right slide there. We put the link in the chat if you'd like to take a look at it. This is a tool to really help practitioners like yourselves, those who support transition, but also CCIs themselves to really understand the different phases and steps in transition. It is a sort of a form of an online resource library where you can click on different steps in the transition process, read more about what that step involves, and then also access resources and examples. So if we go to the next slide, we can just look at phase 1, which is, you'll recall, is around learning and exploration and understanding why the impetus to change. Some of the areas that you can explore on this interactive tool are around building awareness on the reasons for change. What is that, and how do I do it, and what are some examples of, say, key messages? Then there's exploring the local context for transition, really getting ready. What will it look like? How do I consider the context? Identifying, engaging with others. So who are the different stakeholders that I need to be working with as I begin to think about and prepare for transition? If we look at phase 2, great, thank you for changing the slide there. Again, this interactive tool provides us with more information on conducting organizational assessments, how to make links to national child protection and care systems, how to develop a strategic plan, will then provide us with some links of resources. So whether or not we are managers of a CCI looking at how to transition, or we're actually the supporter of the transition process, we can use this tool to build our own better understanding, and also make sure that we are accessing as much of the global evidence and resources as possible. We can go to the next slide. Just for a moment, again, what you're seeing is exactly what's available to you via this interactive tool. On conducting organizational assessments, we go more in depth into understanding baseline strengths, risks, and readiness. What's the most appropriate goal for the organization? Is it full transition? You'll remember from our first webinar that there's sort of two options as you move into active transition, whether that's full transition to a new kind of non-residential service, or whether that's safe closure and divestment from the work with children. Which types of family services might be realistic? Yeah, that's fine. We can go to the next slide. Again, this is just briefly showing you the kinds of information that you're going to find as you move through the interactive tool. Phase 3 really around implementation and those two pathways, full transition or closure and divestment. You'll find information on stakeholder messaging and consultation, post-transition programming, how to make decisions, do assessments, looking at staffing and assessing human resources. So all kinds of things. The tool is really aimed at providing as much information on what the phases of transition are, what it includes, and what kinds of things you need to think about. So let's go to the next slide, which is taking us into that transitioning care assessment tool. This is the second tool of the 3, which Manoranjan has briefly mentioned, using and finding helpful. Put the link to that in the chat just now. This tool is really designed not for the residential facilities themselves or the sorry, there's the link to it in the chat now. It's designed for practitioners. So it's designed for many of you who are working with CCIs in India to transition, supporters of transition. It's not exactly designed for the CCI themselves, but really to take you through an assessment that helps to look at what's happening with that particular organization. It's targeted to privately run institutions, certainly can be used for government or state run, but it's really been built on the evidence from private residential care facilities that typically are foreign funded or have some link with an organization outside of the country. It's not a self-assessment tool. So as I said, it's really aimed for practitioners who are helping to support transition to work through understanding the organization that they're working with. It's not a reintegration manual. It's not a case management tool. It's really aimed at, has questions that are aimed for the supporter to complete. We can go to the next slide. This tool is really a learning tool. It helps us to see some of the trends that are happening within the transition of the CCI throughout that process. Helps to gauge the readiness for change and different aspects of readiness, and really helps to flag some of the areas to look at in developing a strategic plan for the transition. We can go to the next slide. This tool, the assessment tool, can be really, really most helpful as you're preparing for transition. So this would be, if you're following along on that diagram of the phases, it's really phase 2, where you're working with the organization to begin to put the information together that you've gathered, and beginning to think about organizing the actions and really building the foundation for a strategic plan. Some of the areas that the tool will help you to look at are understanding the sort of baseline of the organization, the CCI organization, making the links to your India and also state protection and care systems, to policies and laws, making sure you're aligned to the context, developing a strategic plan, and also assessing and looking at governance. So you'll remember from our first webinar that transition is not just about moving children, but it's really about shifting and supporting the entire organization to either become something new and provide new services to children and families, or to safely and effectively stop their services. Manoranjan, I know that you mentioned you've used this tool in the work of in Tamil Nadu, and so I wonder if you can just talk to us a little bit about. Let's go to the next slide on the structure of the tool, and maybe just share with us a little bit how you've used it across these themes in your work, just briefly.
Yeah, yes, Beth, thank you. Yeah, basically these 7 themes is primarily, you can actually see it is very deeply rooted between the board of management of the child care institutions and the donors, or the director and the donors, or even the caregivers and staffs of the child care institutions. So across these key stakeholders, you can see, so there is a point of commitment why they are running the child care institutions. There is a motivation towards that, why they are leaning towards actually providing institutional care, despite of there is a global research and evidences around the negative impact on that. So there is a strong intent for them, and also there is a psychological ownership that they are doing good for the vulnerable children, and that is also sometimes linked with their own philosophy and value systems. So these are very subtle aspects. So when you are going actually to engage with your stakeholders, so probably on the surface, you only see the very few things, which seems very positive, that they are doing services to the vulnerable children, or even they are interested towards transition. But when you will deep dive, you will unfold these 7 themes, then you can see they are very rooted. It is very deep in their physical, in their mental, and psychological landscapes.
Mm-hmm.
So how they are connected with the institutional care. And without knowing this, you cannot actually really buy in their ownership into the transition process, and you cannot make actually change their behaviors and making them instrumental for preparing the transition plan and supporting the whole process of a transition. In that sense, unfolding these 7 things is very critical, and most importantly, it is very good to know that once you go through exercising these 7 things, at the end, you will actually get a signal. So where does these stakeholders and their institutions actually stands? So it can indicate you with green, yellow, and red, so that you can see whether the level of risk is minimal, whether you can actually prepare them for a transition, or you can actually take a hold and prepare the ecosystems and their behaviors towards the transition, or you have to take some time if it is high risk indicators are there. Let's say, for example, we found when people, basically the child care institution directors, if reintegration is not in their experience, so you cannot make them actually prepare for this transition process. So this is the kind of a matrix you can get if you exercise this tool, and very tangible way it can indicate it in respect to these 7 themes, where actually they stands, and then you can actually measure their intent of the institutional care, and you can engage accordingly with the effective communication methods. That's my experience, Beth.
Great, thank you so much. So as people can see on the screen now, when you use this this transition assessment tool, and there is a form of it online. There's also a PDF that you can use, an interactive PDF that you can use. You get a report at the end, which helps you to see which are the areas that are green, kind of ready to go. That particular CCI is more prepared around, which are orange, perhaps those are some areas where you need to put more focus as a transition supporter. And then red, which is perhaps where you're going to focus much of your time and much of your strategy. Thank you for the questions that I see coming into the chat. We are going to take note of those, and we will hopefully come to them at the end. If not, we will absolutely circle back to everyone on your questions. Let's just go briefly to the last tool before we take a couple of questions. And this is the transition cost estimation tool. Really interesting and important tool, which I think in my work, I'm finding people really using and finding very helpful. This is a tool that's really designed to help both funders and operators of residential care facilities consider the cost implications and try to generate estimates that will really help them in their transition planning. So it's something that the more people use it, the more we're learning about what some of those costs are, but it really captures the complexity of transition. It looks at who are the primary users and their skills. The technical advisor role helps to make better decisions. We could go to the next slide. It can really be used at different points of time, as you can see here, but will help to kind of uncover some of the unknowns, especially around funding. It helps you to source funding for what we would call spike costs. As you probably aware, when you're transitioning, you may need to have a time when you spend money on a new service that you're developing. You have to maintain the quality of care for the children until their reunifications are completed. So really important to be able to look at all those costs as you go. Next slide. I'll just put the link to this tool in the chat as well. It's really important that you have information about the finances in order to use this tool. You can use it as a transition supporter, or you can go through it together with the residential care facility that you're working with. It does require having the annual budget of those operating income and as well as expenditures, the number of children, the staffing structures, and any information about aftercare services. Those are the services for children who will be reunifying and or the transition to new kinds of services. It has lots of information about how to use it, instructions, and tips on each part of the tool. And the result is, again, really a picture of what kinds of costs to anticipate. It will also give you a graph to kind of show when, along those phases that we've been talking about, when you might expect some of the spike costs that I've mentioned. And I think what we're finding so far is that organizations that are transitioning are finding this tool really helpful in terms of their preparedness and as well as talking to their donors about what might be expected on the financial side. So those are the three tools. We've put the links in the chat. I wonder if we have a moment to take a question. I'm going to go to Kavita and organizers because I am not sure how much time we have, but is there a question that we might take?
2 minutes. We can take one question, one or maybe two questions, but we have only 2 minutes. Yeah.
So is there a question already in the chat, those who are following it, or would anyone like to raise their hand and speak out loud a question?
Okay.
Certainly there was a question already about whether or not we can share the slides. We will do that for sure. There is also a question about othering. Why don't we take that one question? What is othering? what does that involve? And I wonder if I might ping that one question to Beck for a very brief response.
Absolutely. It's a good question. It's a anthropology or sociology term, and it basically means when you break people into in groups or out groups, you might call them us and them. And when you do that, it can create discrimination, or it can create stereotyping. So why it impacts on transition is because sometimes if we are working with families who come from a different ethnic minority group or a different culture or speak a different language, we may hold stereotype assumptions about them, and that can influence the way we think about them when we're reintegrating children. It can mean we lead with our assumptions versus lead with rigorous assessments. And so sometimes there might be othering that's going on in between the different stakeholders, and it's important to identify it and then address it by creating opportunities for people to get to know each other, create relationships, so that they start going, oh, you're not one of them, you're actually just like me or just like us. And you break that othering down so that people can empathize with each other. And then the assessment processes that lead to reintegration can actually be based upon real situations and not stereotypes.
Great. So I can see how in transition that would be really helpful, given that oftentimes we have a lot of assumptions, don't we, about what's going on for the different stakeholders who are involved. And I just want to say in a final note, I think all three of these tools really focus us on considering who those different stakeholders are for each individual CCI or residential care facility. So really, really helpful. Thank you, Beck. I'm so glad we have you here with us today. We're going to go now to really an open house discussion on contextualization. So we realize this is a very quick and brief overview of these three tools. We really hope that many of you did the pre-reading and have a little bit more familiarity. Others of you will take that up after the webinar today. But a big question on all of our minds is what is this going to mean for India? How can these tools be contextualized to really help us in our work? And so if we could go to the next slide, what we're going to do is have a conversation with a group of people from different countries who are going to help us to really unpack this idea of how do you shift how do you contextualize and use the tools in your context. So I want to welcome three people who I know and really appreciate their work. They're doing a lot in their countries to support transition. Firstly, welcome to Moses Ondeche from Kenya. Moses is a program manager and a consultant at Ways of Care Solutions. He's got over 10 years of experience, has worked with lots of CCIs to transition, and he is really committed to community-led, family and child-focused solutions. Moses was part of the group trained in Cambodia, along with our second guest, Sokors Hor from Cambodia. Sokors is a... oh.
Hello?
Hello?
Ma'am, சொல்லுங்க.
Could we please mute participants? Thank you. Please mute. Thank you.
Done.
Sokors is director at Children's Future International, CFI, since 2010. They recently received funding from USAID and the Family Care First project through Save the Children. And he's providing direct support to program teams and overseeing their practice of helping to transition CCIs in Cambodia. So big welcome to Sokors, who is also one of the trainers. And then finally, a big welcome to Sam. Sam is a senior staff member of This Life Cambodia. He joined in 2012 and spent the first 3 years working as a program officer to support the youth in conflict with the law program. he has his organization has done a lot of transition support, and we're really looking forward to hearing his experience. Please know that we will also, as part of this discussion, we will be asking some questions where you can participate. So please use the chat, or if you're willing to speak out loud when the time comes, please feel welcome to unmute your microphones. Sorry, we seem to have lost the slides. Can we get the slides back up?
That slide is visible here.
Is it? There we go. Sorry about that. So I would like to go first and we can go to the next slide, the slide with the questions on it. I would love to hear, let's see, maybe from Sam first, and I'm going to ask you to keep your responses brief so we can hear from everybody on the panel and also get to our audience. But Sam, in Cambodia, I'm curious, what was the experience with using these framework tools? What benefit are you starting to see specifically in using the tools? Thanks for joining us, Sam.
Hi, thanks, Beth. Actually, I'm really glad to be part of this workshop. In this like Cambodia, we've been working with prevention, family separation, and reintegration of children from prison to the community. From there, we learned a lot on the best practice of reintegration and support children living with the families. I remember back into Cambodia discussed around the children living in residential care in 2014, 2015. And then there's a lot of involvement from UN agency like UNICEF, engaging with MOSWI, working on the study, and that part's also some of the conflict around the statistic of the children living in residential care institution as well. And then this like Cambodia also part of the Better Care Network. We also share some of the promising practice supporting children reintegrate back to their community from the prison as well. And all of this we learned, and we also share the way, the method we work with residential care and reintegrate children from residential care back to their families, to the MOSWI, and MOSWI also embed our practice into the national guideline. And that's from there in 2019, UNICEF working on the research study. It's about to try to understand around the number of children living in OCI, living in residential care, and also the most we also conduct in coordination with the UNICEF as well on the inside research reports on the result of implementation of the action plan for improving child care. So from there, I guess there's a lot of discussion how we can work together to improve this particular work, and also some discussion around the reduction of number of children living in residential care. So as this like Cambodia is a community focused organization, we listen to, engaging with, and working side by side with the children, family, and community. So from there, we've been able to share our resource, our engagement, and our participation with the policy guideline. And in 2020, we engaged the training and develop of the capacity building roadmaps and TOT training with the Better Care Network. And we learned a lot of tools that we familiar with the 3 tools introduced, the phase of transition, estimate the cost of residential care institution, and other tool that would be benefits. And the benefit from the using this tool is good that so kind of like it helps us a lot to like to shape our implementation to engage with the residential care institution. So as we know, everyone aware that not many RCI really come to the first step. They want to engage for the transition. So these two provided structures approach help us access and make a plan implementation transition with the engage RCI and the process. We engage in capacity like I mentioned with the better care network. It boosts our collaboration with other stakeholders, so we can adopt some of the part of the tool into the Cambodian context. However, we also change the way we proceed working partnership with different RCI due to their unit, their scope, and their capacity and their back person as well. So
Yeah.
Yeah, usefulness. We found this tool really useful. Like shaping our direction to support RCI transition close and also helping them to strategy, having a full concept of like different stage of engagement, like from the awareness raising, from the like first entrant to engage in the transition or close, like implementation, preparation for the transition or close, like starting implementing their transition or closer plan, and then like discuss around like the investment of their RCI work. So, and especially using the tool of like RCI like cost estimate, help us to convince, help us to convince the
interesting.
The RCI to compare that. Oh, that's like promoting family-based care, community-based care is low cost. So why not we work together and
interesting. So
this one Cambodia we use another tool like during the assessment process. We ask the Australian Register Organization. We conduct due diligence assessment with the RCI. So learning what the risk aspect with the partnership engagement with those RCI. So
so this is another tool on risk assessment that you use in combination. That's really helpful to know about that. Yeah. Thank you so much, Sam. I know there's a lot to say, but I definitely want to make sure we can hear from others as well. But really helpful to hear how you've used them and which tools you find. You find the most helpful. I wonder if we might just hear from Kors now. Again, briefly, so we can hear from everyone. But I'm wondering, we're sort of saying to this large group of 80 participants here, here are these 3 framework tools. Go and use them. But so of course, what process did you use yourself as a practitioner to learn more about the framework tools, and how have you found them helpful in your own work? We've heard a little bit about the context of Cambodia, but I'm really wondering about your practitioner work. Welcome, Kors.
Yes, thank you so much, Ben. Yes, and thank you so much for giving me an opportunity to join with this workshop. Yes, and sorry, I use my computer and my computer cannot open like the camera. I don't know what is wrong. Yeah.
That's okay. We can hear you well, so that's okay. Thank you for joining us.
Yeah, so based on the practitioner for what we have learned on how to use the tools. Yes, and also based on what some have describe about the in Cambodia, situation about the UNICEF research, about the ministry, like the government, like Ministry of Social Affairs. Yeah, so we have like we have applies and formulas to use with the tools, and we have learned that the tool that is very like useful for us to like is clear identifies, yes, of the risk, yes, like reassessments, yes, like identifies RCIs, yeah, and also it's like can make us to see it's like so about the clear plan, yes, like what is going to do next, and we can yeah, it's like put this in the next steps, next plan, and find the solutions how that we can work collaborate with the donors, the funders, or the local authorities, or work with the governments like to for a next step, next process to be pushing or motivate for transaction or close the RCI, or some things that that sold us can what kind of support that we can yeah, we can support on to the transaction process. Yeah, so that seems that is very useful. Yes, and
Great.
also yeah, and also very important that we are can work closely with the like the funders or
Mm-hmm.
the donors. Yeah.
Mm-hmm. Yeah. So it sounds like really the process you took to learn more about the tools was to actually use them, which I think is so important. And the more that people use them, the more that we learn about them globally, and the more we can adjust them and improve them. So thank you so much, of course. I think that's really important. I want to keep this really brief, Sam, but I want to come back to you for a moment and just understand a little bit more. Did you have to change the tools at all? Did you have to contextualize them for Cambodia? And what has that process looked like? Over to you, Sam.
All right. Thank you. Of course, the tool have been very useful overall. Anyway, as I mentioned, it's different context and different back person, different Fed donor. So we need to do a lot of strategy. Like somehow we need to like using two tool into one to convene one RCI. So like I mentioned, like we're talking about the cost support, and somehow we also using our overall case management system that supporting
Okay.
prevent child family separation at the community
Yeah.
level as well.
Yeah.
So
yeah.
we also adopt using the cost of support into our like case management, holistic case management support as well. So like we try to help the residential care to understand that we work on this area. It's our approach and strategy to engage more donors to come. And then it's easier than to convene to other specific donor just in the scope that the global now consider about the RCI transition, promote family-based care. So it's direction to donor consideration. So this one advocacy, like the spirit of the advocacy voice that we could convey them as well. And I guess another thing is that Cambodian context need to consider integrate this tool into the social service workforce training, which is we build from the concrete step that people working in this area, working in social service workforce, they are in the front line supporting children at risk of separation. They are
Mm-hmm.
they are the one who links the service to the children when they come into at risk of separation. So
Yeah.
this would take them to consider whether they decided to finding OCI or they need to seeking other like community-based, family-based service organization to provide support. All right.
Great. Thank you. Thank you, Sam. I think that's really helpful. I know, noting that Rebecca in the chat has also noted that language translation is really important into, for non-English speaking countries. That's excellent. We've got a second here. I really would love to hear from participants in terms of other tools that are being used for transition already in India. Anyone like to raise their hand here? We heard from Sam, case management tools in Cambodia are being used to complement the use of these 3 tools. Would anybody like to speak out loud what tools for transition are already in use in India?
Good evening, ma'am. I'm Shiva.
Hi, Shiba. Thank you. Yes.
I'm project officer of Changing the Way We Care project in
Welcome.
Kanyakumari, Tamil Nadu. Here is my answer to this question. One of the most important thing in transition is to identify and address the specific needs of each child and family. For this, we use the case management tool, where we identify the needs through comprehensive assessments. We do the case planning and intervention and regular monitoring and follow-up for each child to ensure proper support is given to them. In Kanyakumari, children and family also faces a lot of issues such as domestic violence, alcohol addiction, and substance abuse, which are contributing factors to institutionalization. Also, during the transition process, children and family can face mental stress due to the sudden changes in environment and care. To address these issues, we use the psychosocial support module, where we identify such cases and refer to the right mental health professional for support. Lastly, the most important tool that we use in gatekeeping module, where we work to strengthen the existing local government, faith and community structures, and civil society organizations to mobilize support for vulnerable families and their children to prevent unnecessary child-family separation and institutionalization of the children. Using these tools, we feel we will be able to effectively implement transition tool in our country. Thank you.
Thank you. That's really helpful. So this is a great example from Tamil Nadu in India. I heard use of case management tools. That seems to be a theme that's really coming up, but also those different tools that can be used for prevention. So Sana, thank you. I see your hand. If you could just be brief with your example, please, so we can move on to our next panelist. But yes, please.
Surely. Thank you, Beth. I'm representing Miracle Foundation India here. So very briefly, I would like to take the attention to the first webinar, the first part of the webinar, wherein Ms. Preeti Seth from Miracle Foundation India talked about the 6 steps of transformation which we used. And I will very briefly share about the different tools that we used throughout the 6 steps. So during the initial step of post the orientation, there was a step of inspirational dialogue with the leaders of the orphanages of the CCIs, wherein we use the tool called UCD, which is Understanding the Child Demographics, which helped us identify the reasons of separation. And secondly, I understand the geographical characteristics. If the children are coming up from a particular area, what are the reasons there, etc. The second tool which we utilized was the strategic review, which helped us do a strategic review of the organization. This included envisioning exercise with the organizations, developing a new business plan, staff assessment and redeployment, and finally the new business plan, as I said earlier. And in the implementation phase, the co-design phase, we did develop the consultative evolving plan, which was at that time the 2-year plan of transformation, but it evolved in consultation with the CCIs as we progressed in the journey of transformation. And finally, for implementation, we did utilize the case management process
Great.
to oversee the process. And another tool which I want to mention here is not related to the entire, not related to the transformation of the CCIs as such, but somebody did mention in the mentee activity something about the family assessment tools. So at Miracle Foundation, we do utilize, of course, the social investigation report, which is the JJA Form 22. But besides that, we also do utilize the Thrive Scale tool, which helps us assess the families on 5 well-being domains.
Yeah.
Thank you.
Great. Thank you very much. We want to have time for a couple of other panelists questions here, and I know the time is getting tight, but this is super interesting and important. So thank you for those inputs. Any links that you can provide in the chat, any other things that anyone wants to share about tools that are already being used, really helpful. Let's go to Moses. I am really eager to hear. I happen to have had some experience in Kenya. Moses, can you talk a little bit about the process that you've been taking in Kenya to use these global tools to complement what already is in use in the country? I know there's some national guidance on transition. How do you see these tools complementing that? And what's been the process for really bringing the global tools and the national work together?
Thank you, Beth. It's good to be here and an honor to be part of this team as we have these conversations. I would start by first saying that in Kenya, we are very grateful as a country for the immense efforts that were put in early in this journey for not only Kenya, but the world through UNICEF and changing the way we care. In Kenya, we had a lot of engagements with Catholic Relief Services, as well as Lumos, who have given a lot of their time and investment and resources to make sure that there were national guidelines that were put in place. We have the Children's Act that was put in place. I think for India, it would probably be close to what you have as the Juvenile Justice Care Protection of Children Act. In Kenya, we have the Care Reform Strategy that was put in place. I think in India, you probably have the Integrated Child Protection Scheme. In Kenya, we had the Child Welfare Program guidelines that was set up to help in guiding on how will this new model of care look like. And so we have that. And then, of course, as we continue in this journey, we have the national guidelines for transitioning childcare. And so what we see is, and we've continually appreciated, is how the better, through Better Care Network, the resources that were put in place to build these 3 tools have really been beneficial for the country. One is when we initially started off, and we had the phases of transition interactive diagram out by BCN, we took the time as a country to look at that, and that helped us to build what we call our transition roadmap journey for every single institution. And so that in itself has helped us to put structure in place to help with that journey. So that is not necessarily a theoretical idea, but it is a practical step-by-step journey for institutions. And that was very beneficial for us as a country. And so I continually see that resource being beneficial not only for us as a country, but East Africa as a whole. Because as the continent continually builds this very important resources from a legal perspective, from the national governments, they help the countries to put a structure, a foundation for how that journey will look like for not only the institutions, but we're talking about the government itself. And so we continually see the benefits of conversations that we're having right now in regards to how do we continually contextualize these resources. At the moment, we're working to build consensus around how to best use the transition model of care assessment in the country. But again, we also realize that since we have all these structures in place, in itself, it does not necessarily appeal as much, just because of the fact that we already have legal representation that propels institutions towards adhering to the legal framework, which means then they already have a pressure and a pull to make the change. And so in itself, it shows just also the ability for that we already have seen within, and I remember having these conversations with you, Beth, and Rebecca in Cambodia around the fact that practitioners through the transition model of care assessment tool have a language, have words that describe the thematic areas that affect the readiness of an organization to transition. And in so doing, there's a lot of experience that practitioners have had over the years, and they now have words to those experiences that help them, as Rebecca was, talked about earlier. You're more of now a detective, and you're identifying things that stand out and help organizations or you as a practitioner on how you can best support them. And so that in itself has really been beneficial to us, because we sat down, looked at that tool, and we're like, wait, we now have a language for what we see. Like, we've experienced this so much that now we have some language. And then now talking about the cost estimate tool, which has also become a very hot topic in the country. In regards to how do we put together a resource that helps both institutions but also government to plan on how this whole journey will be supported, will find funding for it. And so we really are working on developing tools that are very contextualized to our Kenyan context and experiences, but also in East Africa, there's a lot of commonality within East Africa,
so
within Zambia. So across countries as well, having conversations around, let's not replicate things that are already existing, but let's build on them.
And that are working. Yeah, great. And I know in that context, you also have you have donors who are supporting residential care facilities in different countries. So that's really quite helpful. So I guess I want to welcome our other panelists to continue to put your insights into the chat for the sake of time. But Moses, while we have you, you were part of the Cambodia training. We haven't talked a lot about the training of trainers, which is really I'm going to call that another tool. It's been really important. It's important for this capacity building. It helps people to know how to contextualize these three tools. And you were part of the training group in Cambodia, and then you were part of organizing and implementing a training of trainers for East and Southern Africa, which had, I don't know how many, 12 countries participating. Can you just briefly talk about how was the TOT training contextualized for that context? Were there things that you had to change with the training manual or with how it was rolled out? Because I know this is something we're going to want to do in India as well. Thank you, Moses.
Thank you, Beth. Yes, I will first again say thank you to BCN for the great opportunity we had to receive this training, Catholic Relief Services through Better Care Now, Changing the Way We Care. That was very beneficial for us to get that experience. But then it was now, the challenge was to how do we replicate this back in the continent, and seeing the desire and passion that we already have, not only as trainers, but also as a continent, and how hungry the continent is to move forward with transition. And so the experience was immensely informative, immensely amazing, just seeing over 12 countries come together and speak one language. Like, we have to identify ways to make these tools valuable and beneficial for us as a continent. The first thing that we saw was, and we needed to work on, was the fact that we have all these examples that were that we had as within the different tools, and we needed to identify ways that this can be replicated within the continent and be examples that are also relatable. And so what we did was start identifying, even though we didn't have that much time, start identifying how can we contextualize even the different examples that we had. And so that was not necessarily something that we did successfully, looking at the local context. But to be honest, we didn't have to, because there was a great, clear understanding from the different examples we had that gave everyone a better understanding of the tools. I think we went in there thinking that we were going to explain every single thing, but the fact that everyone had a good understanding of the tools, but also the examples were very clear. We were getting a lot more feedback from all the participants in regards to how can we make this better, what examples do we have within our own context and and experiences that can enrich these tools. And I believe that going in with the desire to teach people who don't necessarily have an understanding of it is great, but having the openness to listen to what everyone else has to say is even way more immense, because it enriches the whole experience and gives the opportunity to learn from others. Yeah.
Great. Oh, that's super helpful. And I hope that the participants here are beginning to get a vision for how this could be helpful in the India context. We're really running tight on time. I want to welcome continued engagement in the chat. I see that there's some really nice inputs coming in from our other panelists. I wonder if there's just one participant who might like to speak out loud to this this last discussion question, which is, what might be the key aspects of contextualization important for these global tools and the training to make them more user-friendly in India? Is there anyone that would like to comment on that? Again, just briefly. If not, we will, oops, Sana, yes, thank you. Would you like to, again, please keep it brief, and we'll would love to hear from you.
Surely. So when we talk about contextualizing tools for India, I think one of the things which doesn't go well here in our experience is the use of strong language, particularly the negative language like deinstitutionalization or closure. Secondly, another important point is to align the tools with the legislative frameworks, including but not limited to Juvenile Justice Act, the Mission Vatsalya, and triangulating the findings from the different tools, particularly in Indian context. What we are getting from one tool should complement the findings of other tool. Then risk management, risk assessment should be built in the tools, considering the child protection landscape of India. And finally, being a co-traveler with the organizations in the journey of transformation, and not just guiding them or instructing them.
Yeah, great points. Those are great points. Thank you so much. And I'm just amazed. It's so helpful to hear these examples, to see the examples in the chat. I want to give a huge thanks to Sam, Sokor, Rebecca, and Moses for sharing your insights. I think it's really giving us an important view of how this might be helpful in India. Manoranjan, I'm going to turn to you to just close this session really quickly, and then turn over to Sandhya for a few moments on our next steps. Thank you, panelists.
Yeah, thank you, Beth. There are really some good stuff have come from the insights of the participants. And I mean, it is very important also to look at the stages and the phases of the transition, and also considering the different elements of the transition. And the points is very well connected. So including the language, including the risk aspect, and also to align the process and the procedures with the national child protection policy and schemes and programs. So all these points are really very valuable, and we can take into consider for the contextualization. So I would also encourage actually the participants and esteemed friends to keep continuing writing in chats if something comes to your mind in terms of neither particularly for the subject, but from your experience of contextualizing the global tools in India context as well. So with this, I would like to actually invite Sandhya Misra, the co-convener of India Alternative Care Network and a senior director at Miracle Foundation, to lead us to the next steps of this event. Welcome to Sandhya ji.
Thank you so much. Thank you. So of course, it's a 2 hours time, but it looks like we need more discussion. I hope I'm audible.
Yes. You.
Yes, yes,
Okay.
you're audible.
Okay. So in terms of what is the next course, I just want to, summarize our today's session also, like in terms of the webinar part 2, that like Rebecca said, that it's a complex process. It is not so easy, but it becomes easy when we have people with us, collaborator with us. It is not possible someone working alone. So the objective of today, which wanted to explore more about the global transition tool, your feedback and suggestion, how to contextualize it. And we got wonderful feedback from Cambodia, from Moses, from, India. So we spoke about 3 important pieces of global transition tool, which is of course a part of creation by a working group. It took 3 years, more than 3 years. So we talked about the phases of transition diagram, where it's a learning and exploration, preparing for transition and implementation. So this is the first diagram we need to understand. And the second piece about the transition care assessment tool, where very nicely is mainly for the privately funded organization, privately funded institutions. And very nicely it has mentioned about the theme, all the 7 themes. And based on those 7 themes and tool, you can very well assess the score. Where are you? In the CCI, in terms of the green, red, and yellow, it gives you a very good evidence in terms of indicator. Accordingly, you can make your plan. And the third, very important, is a transition of cost estimation tool, which is very important for donors, for, especially the people, those who are into the decision-making authority, where it is important to do the baseline, what is our cost for the core services, then we have additional spike cost, and then we are new services. I think it is very important for all of us to think about the new services, because if we create more awareness, we also need to do the supply piece. When we say supply in this alternative care, we really need to invest our time and energy towards a family-based alternative care. Because all said and done, we know children need, some or other time temporary out of the family setup when they are not safe in the family. So with this kind of, summarization, I also really like to compile the feedback which we got from the, sharing from the, experts and speakers, that basically the tools which we got to know, it is about the engagement, it is for the assessment, it is for the decision making, it is for the implementation and monitoring. And for whom we do for children, we would do for family, childcare institution, donors, and the government stakeholders. And the boundary condition which we really need to understand about the common language, what is the context of that country, when we are talking about the strong language which is not going well with the context, seeing the dynamics and the situation of the country. So that is something very important. Risk assessment, these are some boundary condition about the today's webinar. So now with that, I want to go ahead with the next step. I want someone to run the slide. Go to the next slide, please. So I think now it is important that what will you suggest for promoting and rolling out these tools? This is a Q&A, but because of the paucity of time, you please post your response in the chat box, what you want to share, that what would you suggest from now onwards. Few things which we thought, which we would like to share it with you, but feel free to respond to this question in chat box. Next slide. So this is something, the next way forward, that we are going to have 2 physical workshops. And but before workshop, there will be a tool contextualization piece. So this is the workshop is meant for tool contextualization and master trainers training, like what Manoranjan is one of the master trainers in, attended in other country, but this is for India. So then we need to do this. So please, whosoever is interested to be part of this journey, please share your name and your email ID in your feedback form when we are going to share the feedback form with you. We would really love to get your name who wants to volunteer for this, the next way forward for India. This is for India. This is not restricted to one organization or one state. So this is one piece. The second is there are some criteria that there should be commitment to take the transition process forward, that with partners, with government, the kind of work you are doing in your geography. So that is something very crucial. And also you have a significant experience working in family-based care. This is one criteria. Those people who would like to volunteer, and then full commitment to provide in terms of all the preparatory work. It is something which, if you said yes, then we accept you, in totality. It is not something that we would like someone to drop out. So we would really want, your strong commitment towards it in terms of all the work, follow-up and preparation, and then commit to become a champion in the transitioning care initiative for India, rolling out the training to others, and have significant experience with supporting transition and a skill as trainer. So that is also something which, when we talk about the trainer, this is something, the condition and the criteria we wanted to share. If you have any question related to this particular next step, feel free to ask question. Still, we have 10 minutes time. So we can take 2 minutes or 3 minutes to answer your questions related to this next step or way forward. And if not possible, that we would, once you share your question, your feedback, we are going to share a complete FAQ answer through you on email. That also we are going to do. That's a plan. Okay, so do we have any question?
Sandhya, we have one comment which I think is really important from Anjali Sood. It looks like having government buy-in is really a must. I wonder if anybody else has any thoughts on how do you best do that? What might be some next steps on government buy-in? Definitely agreed there.
I would really want some expert and speakers, those who participated, if they want to share that how in their country they actually use this in a government buy-in, or Beth or Beck, if you want to share.
Or even India colleagues on what might be some next steps to build government buy-in around this. I'm sure Moses could speak to Kenya, but it'd be interesting to hear what people think for India too.
Anyone from the participants also can respond to that how to make, because this is a collective learning.
Maybe Sandhya, I can actually come forward. Later also participants can come.
Sure.
So from our experience, like we have already discussed last time, and government buy-in is a must, because in India, the child protection system is robust. And all the child care institutions maximum, they are registered under the Juvenile Justice Act and rules, right? So considering the elements of a transition, when we are talking about reintegration of a children, safe reintegration, we are talking about case management, we are talking about creating new programs at the child care institution level, we are talking about changes at a different level of the organizations who are offering institutional care. So to all these dimensions, there is a connection with the child protection system and the procedures, right? So in that sense, without the buy-in of a government, you cannot think about the transition in India context, in my experience. So once you plan and think about transition, the first thing is the District Child Protection Unit and the CWC. There is a question about the CWC should be, in the same pace, because unless you do a gatekeeping at the CWC, you check the new admissions at the CWC, you cannot think about transition, right? So after the transition, following up the children, providing case management and follow-up support, sponsorship, linkage with government schemes for family strengthening, monitoring the children, creating new programs, aligning with different departments for all the things. So government buy-in is a must for effective, successful, and a safe transition. Yeah, that is my reflection.
Great.
Over to you.
Great. So thank you, Manoranjan. I think it is very important for us that when we see this work, like how it can benefit India. So very important piece that once we have some clarity in going ahead, take this to the government, and because Mission Vatsalya talks about it, so we have a very important like a background. It's not something we are working. Civil society is working on their own. This is a government mandate. So conversation, spending time. I am going back to the 9 P's which Prabhat shared in the first workshop, taking this to them and talking about that. I also would like to share one important piece that we are going to share a list, a template or sheet where you can add your name, those who are interested to volunteer for tool contextualization and the training further. So that is something which, I would like to share. Anything, Kavita, if I missed out, feel free to take up from here. Thank you so much.
Thank you, Sandhya. Thank you so much for summarizing it. And yes, I just wanted to again share that we will be sharing this sheet to invite the interest of the participant who wants to further, give their commitment towards the TOT of the program. But you have to keep this in mind that this is going to be a time-consuming, time intensive program, and we would really appreciate people to come forward and take this this transition training further, but keeping in mind that you have to be involved throughout the process, and you have to commit and have to be available with respect to the criterion that we have just shared. So on that note, I would just like to say a thank you to everyone. A special thanks to Beth and Rebecca and Manoranjan ji for taking us throughout the transition tool, what the transition tools are all about, how we can use it, how we can contextualize it in the Indian context. And it was really a wonderful and enriching experience. And a special thanks to our partners from the other states, Cambodia, Sem, Soccer, and Moses, for sharing their experiences of contextualization of the tool. It was really indeed a very enriching experience for all of us. And your inputs have been well taken. We will be compiling all these inputs and making sure that when we do our own contextualization, we use your ideas as well. Thank you so much for joining us today. And a very, very special thanks to all the participants who were there throughout the process and have made this webinar very successful. We really request everyone to share their feedback on the webinars. We will be sharing the link again to share the feedbacks, and we'll definitely share the presentation and the recording of the webinar with everyone very soon. Thank you, everyone. Thank you so much.